Thank you. I want to thank everyone for joining us on this session today. This is the session on wellness around traditional community health. I'm your moderator, Sydney Sevier, and before we begin, I would like to go over just a few reminders with you. First, please know that this presentation is being recorded, and at 5 minutes till the end of the session, that's when we'll stop to do our question and answer. If you'd like to submit questions, please submit via the Whova app, and then click the vote to thumbs up your favorite question, and that's how we'll prioritize the questions for the speaker. If you're having any technical issues, please use the chat feature in Whova to request TA support. And please don't forget to fill out the session feedback for both this session and the overall conference. Not only can you win a $50 Amazon gift card, but it really helps our speakers. And you can find that on the survey link on the Whova app, or under this session, it should say rate my session. And with that, it's my pleasure to introduce my colleague and the program coordinator for the WATCH program, Denny Medicinberg.
Thank you, Sydney, for that wonderful introduction. So we'll hop right into it. Let's see. Ipiva in Sita voice. Natista, Denny Medicinberg, Nahashive. Good afternoon, everyone. My name is Denny Medicinberg, and I'm an enrolled member of the Cheyenne and Arapaho tribes of Oklahoma. Today, I want to introduce to you wellness around traditional community health. The WATCH program brings nutrition and physical activity education to American Indian communities in the Southern Plains region. Presenting with me today are Miss Alexis Hamilton, Francisca Toledo Alexander, and I would like to recognize Dr. Susan Sisson. Our discussion today will include a brief project overview, implementation and community engagement efforts, and how we were affected by COVID-19. Also, the utilization of the community readiness model to strengthen relationships with our tribal partners, and we will conclude with a short question and answer session. WATCH is a program under the Southern Plains Tribal Health Board and Oklahoma Tribal Epidemiology Center. We are funded by the Center for Disease Control and Prevention's Tribal Epidemiology Center Public Health Infrastructure Grant. We have worked closely with our contractor and consultant from OU Health Science Center's Department of Nutrition, Dr. Susan Sisson, and together we have developed this child health and wellness program to enhance the lives of children ages 3 to 5 years living in the American Indian communities throughout our region. The communities we have served include Wyandotte Nation, Eastern Shawnee Tribe, the Bearskin Clinic, the Cheyenne and Arapaho tribes, and the Clinton Indian Health Service unit. We strive to bring a culturally relevant multi-stakeholder intervention to each community. As I stated, our program serves the 3 to 5-year-old population in these communities. As tribes become more interested in our program, we ask that each community at minimum have an early childhood learning program and a local tribal health clinic in their area. The focus of WATCH provides primary prevention efforts and encourages healthy behaviors that increase physical activity and nutrition education, with providing ways to limit screen time. Some of our overarching goals include working with our communities, and we aim to increase or create healthy spaces for children to learn and grow, implement an intervention that promotes healthy growth in clinics with healthcare providers, as well as the preschool teachers in their preschools. We find ways to increase communication between each stakeholder group, and we refer to this group as our 3 Ps: the parents, preschool teachers, and healthcare providers. Overall, we hope to promote healthy weight, growth, and development in our preschool-aged children. As you can see, the logo we created is our brand. This brand allows us to create a meaningful way to tell our story to the communities we serve. The tree is our foundation and protector of our environment. As it grows, the trunk is representative of our 3 Ps, and as you can see, we have been able to capture some native influence in the eagle feathers with children doing physical activity, and across the top, we're able to capture nutrition with fruits and vegetables. The dots above each leaf is significant to the unwritten narrative, and we hope these children learn and grow well across the lifespan. We want to portray that we are watching children over time to increase their healthy behaviors. As we begin gaining interest from each community stakeholder, we usually begin with an introductory meeting with the education sector and then confirm with the healthcare provider group. Then follow up with each group and bring both stakeholder groups together in a kickoff meeting. During the kickoff meeting, we provide this slide to be a menu for each stakeholder group. This is the optimal version of each stakeholder. As each stakeholder considers this model, they can select which items are feasible and practical, and this helps us tailor the program to the community wants and needs. For example, in the early childhood center bubble, we offer opportunities to develop or enhance their garden. We provide them with the best practice menu that uses CA-CFP standards, as well as the Oregon Wise Guys curriculum. We usually begin implementation with this stakeholder group with a responsive feeding training with Dr. Dipti Dev. The other training and resources areas that we focus on for the healthcare provider include training with Dr. Ashley Whedon, and she provides training to our providers on obesity, sensitivity, motivational interviewing, and clinic efficiency. They also receive the Oregon Wise Guys materials to hand out and educate the child and their families on ways to increase healthy behaviors. Such items include handouts that allow them to track their water intake throughout the week, and also identify foods that are a little healthier, so that allows them to become more educated. We have also developed the parent toolkit for our parent group. We have used education from NIH's Eat, Play, Grow curriculum, and the toolkit also includes nutritional and physical activity guides and education from CDC's milestone infographic. We also utilize the Oregon Wise Guys curriculum. Oregon Wise Guys has been on a mission for over 2 decades to be the global solution to childhood obesity. Most of us know Sesame Street, and their characters teach our children ABCs and 1, 2, 3s. Oregon Wise Guys characters teach lessons linked to nutrition and physical activity. As we visit each center and hear the children, this message resonates to everyone involved. Eating healthy foods, eat foods that are high in fiber, drink lots of water, and always remember to exercise. These rules remain consistent throughout the curriculum as students can see how these smart habits build a foundation for a healthy lifestyle. This component also teaches the teachers and the kids to do exercises together, and we call that Wisercise. Now Francesca will take us through the parent toolkit and other planning for parents.
Thank you, Denny, and good afternoon, everyone. I'll go over the development and planning of the parent component for Watch. After the first implementation, Watch focused on creating a stronger parent component that really focused on nutrition and physical activity within the Cheyenne Arapaho community. We aligned our Watch nights to be with their existing parent meetings that were held once a month at one of their 3 Head Starts. And we were able to use those meetings to present lessons for the parents and children. Each night we used a lesson from the Eat, Play, Grow curriculum from NIH. And this lesson aligned with our Oregon Wise Guys curriculum so that we could reinforce what they were learning in school and provide them with resources at each night. And so we had a physical activity theme, a nutrition theme, and a food demo night. Parents and children were given incentives. They focused on within that toolkit, and Eat, Play, Grow recommended books that they were able to take home. We also provided recipe cards for all those that attended, and all families who attended were able to take home a crock pot as a main incentive. While COVID-19 halted our last lesson on the community, all parents at the meeting were able to be receptive to the lesson, and it was a great time to provide education. This is an example of our first watch night at Canton Head Start. This was our physical activity theme, and we really focused on movement and provided each child with physical activity cards that showed them how to do stretches and exercise moves. In the top left, you can see our graduate assistant, Hope, demonstrating stretching to children, and on the right, I'm showing how to climb a ladder. And so this was held at the Canton Head Start. And in our second watch night, we were able to go to the Concho Head Start, and we partnered with Tara Conway, who is the diabetes educator for the Cheyenne Arapaho tribe, and she provided a food demonstration with a crockpot chicken recipe card that we developed to show parents hands-on how to use the meal and the crockpot. And this was a really great bridge for what the tribe provides. And usually she provides food demos in the healthcare setting or in the community. So it was really great to have her this night to demonstrate the recipe that we created. And in the next photo, you'll see that we even had attendance from Christy Purdy, who is a dietitian at Clinton Service Unit. And this was great to have our partners there and show some great activities for everyone. And this recipe card is available online. Next, I'll discuss Watch's evaluation measures. Each stakeholder receives assessments as previously discussed by Denny. Prior to COVID-19, all stakeholders were assessed in person. Head Starts had pre and post observations in the classroom. We had monthly evaluations for healthcare workers, and surveys were given in person. But during COVID, we had to pause, the centers closed, and we did not complete implementation at Cheyenne Arapaho. So we went back last fall when they resumed classes, and we gave them our new self-report in the Learning Center environment. We emailed it to them and they emailed it back. Moving forward, we will continue to use the EPAO SR, and as conditions improve, we could go back to on-site evaluation measures, but for the health and safety of others, we will continue to use the self-report. And a lot of our surveys can be sent through constant contact, and we will continue to utilize that moving forward. For parents, some evaluations that they receive are sugary beverage surveys and physical activity, and what they think about going to the doctor assessments. Watch evaluations are reported back to the community, even though not all of our measures are mentioned here. We inform our stakeholders of their results, and we're always ready to be in the community as needed when it is safe to return, and we look forward to being in the community again. Now, Alexis Hamilton will discuss COVID-19 impacts with the program. Thank you.
Hello, my name is Alexis. Fran did a really great job about going over how COVID has impacted our evaluation, and I'll go a little bit more in depth about how it has impacted our implementation and what we've done in the meantime. So whenever COVID first came around and everybody had to quarantine, it really put a pause on all of the activities we were doing in the community. We could no longer go into our communities because all of the Head Starts, clinics, and learning centers were reduced down to either 0 or essential personnel only. And because of this, we had to move everything online. So from then on, we've had all of our meetings via Zoom or over the phone. Our planning and implementation has also, it was paused in fall 2020. We're really hoping to resume planning and implementation this fall and get back into our communities whenever it's safe and everybody is comfortable. So some of the things that we've been doing in the meantime We have been reviewing the cultural competency of Watch. This is really important to us just because we want to make sure that we are approaching all of our communities with respect and listen to them. We really value their feedback and input, so we want to make sure that we take into consideration what they have to say. And we want to make sure that we keep the child at the center of our focus and improve the overall outlook of their life. And it's also important because every tribe and community is unique, and we want to pay a respect to that. Anything we gather as far as assessments, we want to make sure they're culturally relevant and purposeful. Some other things we're doing are modifying our current evaluations to align with our grant deliverables. So with our grant through the CDC, they require us to complete and meet certain points. And so we want to make sure that everything is being met the way it needs to be, and that it is the same all across the board with all of our communities. We would also like to remain flexible and adapt the program. We've been working on that during COVID as well. So anytime a community maybe needs something, we try our best to give it to them in a way that they can still utilize it. And we're also creating a manual of procedures. This is more of an internal document. This ensures that we stay consistent throughout each community. It gives us infrastructure for planning, training new team members as we expand Watch, and it gives us a foundation that we're able to go back and see what we've done, how we did it, if anything needs to be modified. It also gives us instructions for support, and it gives community members an idea of kind of our behind the scenes efforts. Our biggest effort that we are working on currently is our community readiness model. And we want to make sure that whenever we come into a community that they're ready for our program. And if they're not ready, we want to find out maybe what they need or how we can accommodate them. The whole reason we are doing the community readiness model is to really prepare all of our implementation efforts from the curriculum to the menu and make sure that it is specific to the community that we are in. Making the menu recommendations has been one of our bigger challenges, so that's mainly why we started doing it. We want to make sure that whenever we go into a community, they can adapt to what we give them. So we want to make sure they have access to the foods we recommend, and they have the ability to create them as well. So we start with a pre-assessment. It's a little short and sweet, and from there they get a score. From that score, we'll go into the focus groups and kind of break down maybe some challenges they have, what they really like about their menu. And we really want to take the time to find out what they enjoy doing, any challenges, any difficulties. So from there, we're able to give them personalized recommendations when it comes to a best practice menu. We really want to make sure that they can accommodate to it. So some of the other things that we are looking to do is to maintain our partnerships with our current Watch communities. So when we get back into the communities, we want to make sure that we still have that rapport with them and we can get back on track and just make sure that they know that we're still here for them and that we want to continue the program with them. We also want to provide technical assistance and evaluation services to all of our stakeholders. So whenever we complete evaluations, we want to make sure we give them those results to their community so we can show them how we've impacted them, how things have physically changed. And we're really hoping to resume planning and implementation with our Comanche Learning Centers, our Kiowa Head Starts, and the Lawton Indian Health Service units this fall.
Thank you all for joining our session today. We created this thank you card, and it says thank you in all of the languages of each tribe that represents or participates in Watch. And that's the Eastern Shawnee, the Wyandotte, the Kiowa, the Apache, the Cheyenne, the Muskogee Creek, and I don't think I left off any. But yes, we thank you all for joining us today, and we hope you enjoyed our discussion and introduction to our program. If Sydney, I'm not sure, did you put the link to our resource page in the chat? It's www.spthb.org/watch. and that'll take you to give you another overview. And if you click on the resource button, that allows you to access some of the recipe cards, a physical activity calendar, and also a nutritional calendar that you or families can use. So, thank you.
Thank you so much, Denny. And no, I did not. And I wonder if April is with us. I can't see in the same way that you can, if there's any questions that have been posted. Okay, well, give me one moment. I'll try and get in there and see if I can look at them.
Yep, April put it in there for us. I can see
Great.
that. Looks like. Yep, just remember to fill out the evaluation for this session and the overall conference evaluation. I am on the Whova app. If you have any questions or in our service region, we definitely like to hear about your educational programs for this early childhood group. But yeah, thank you guys so much.
I think I might once was people were asking about virtual programming for implementation. Is there anything you wanted to add about that?
Do you know the specific question?
There was virtual programming considered for implementation? And then another one was, has participation dropped or remained the same since you started virtual sessions?
For the implementation, I would have to say that every group that we've tried to expand into, their schedules have been so irregular, just due to teachers getting sick and sites having to close. So we have paused that implementation in hopes that they do get to resume back in class like the Cheyenne Arapahoes did back in September. So we really haven't adapted to the virtual classroom, just because in my point of view that not every child that goes to that center may have equitable access to internet. So we don't want to leave anyone out. However, once they are back in school and if they attend class at the site, we do have a virtual platform for the Oregon Wise guys that they can view on any electronic device, and that story will read to them. They can also watch the movie and access some of the videos. So that, as far as that goes for virtual learning, we have not implemented anything for Watch that specifically handles that type of classroom. And maybe we didn't say it clearly, but we're very community engaged with each stakeholder, but we do not teach the curriculum to those sites. We really give that autonomy to each teacher, each site, each classroom. So they're able to, if they do go to virtual, they'll still, I'm sure we have a lot of bright teachers that we work with, they'll find ways to overcome that if the students do have to learn from home.
Thank you so much. And that looks like all the questions. So I just wanted to thank all of you so much again for presenting. I love the session, and I want to remind everyone, since we have a little bit of time, don't forget to rate this session and provide your valuable feedback. And thank you so much.
Thanks, Sydney.